Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy Therapeutics series. Today I'll be discussing cough remedies. Now, bear in mind that there are lots of cough remedies for lots of different kinds of coughs. So, in order to ensure that this episode does not go on forever, I had to limit the remedies covered here to some of the most commonly indicated ones. Treating a cough can be tricky business. It requires keen powers of observation on the part of both practitioner and patient. When I ask a patient about when his cough occurs, for example, and he answers all the time, I know it's not going to be easy. Oftentimes, the homeopath's job is to educate the patient about how to observe and identify symptoms and their patterns. It's important to be able to detect patterns of waxing and waning and modalities that aggravate and ameliorate. All right, with that said, let's talk cough remedies. Okay, so Pulsatilla is a very commonly indicated cough remedy. The cough is usually worse upon lying down at night. It prevents sleep and is ameliorated by sitting up in bed. The cough is aggravated by warmth in general. It's worse in a stuffy room with no moving air and worse from the warmth of the bed. It's ameliorated by cool open air or by the fresh air of an open window. The cough is changeable and unpredictable in character, but tends to be dry at night and loose in the morning. There may be a mild or moderate fever, and the accompanying nasal discharge is also changeable in character. It may be thick or thin, or green or yellow. The person is generally warm-blooded, thirstless, and prefers attention and consolation. Children who need pulsatilla are weepy, clingy, and like to be carried gently about the room. Bryonia is another commonly indicated cough remedy. The cough is dry and is worse from any kind of motion or exertion. The person tries to remain still so as not to trigger a coughing spell. There may be an accompanying headache or sharp stitching chest pains, both of which are aggravated by coughing. As a consequence, the person holds the chest or the head in order to brace from the motion caused by coughing. Since even the motion of breathing can aggravate symptoms, there's a tendency to take shallow breaths. We may see this dry, painful type of cough in cases of flu, bronchitis, pleurisy, croup, and pneumonia, especially right-sided pneumonia. The person with a Bryonia cough is usually chilly, irritable, averse to being bothered, and thirsty for large quantities of cold drinks at long intervals. In delirium, there may be a desire to go home, even when the person is already at home. The Spongia cough is a dry, barking kind of cough that comes from the throat, larynx, or trachea. This cough is often triggered by exposure to cold, dry winds. The main cough modality is an amelioration from drinking in general, but it's especially better from drinking warm drinks. Sometimes it is aggravated by cold drinks. The cough also tends to be worse before or after midnight, and the cough can be aggravated by touching the throat, especially near the region of the larynx. Commonly, there is hoarseness of the voice. In cases of croup, the cough can sound like a seal bark or like a saw being driven through wood. There may be anxiety caused by a feeling of suffocation, as if breathing through a sponge. This is often associated with a sensation of a lump in the throat or constriction of the throat or larynx. This often occurs on waking between midnight and 2 a.m. Drosera is one of the main remedies for pertussis, aka whooping cough. It's also indicated for a variety of additional respiratory conditions, including bronchitis, croup, and tuberculosis. Drosera fits intense, rapid-fire coughing fits, which are often caused by tickling or choking in the larynx. In addition to spasms of the throat or larynx, there may be spasmodic cramping of the hands, chest, back, or abdomen. These prolonged paroxysms of spasmodic coughing can be exhausting, and the person may hold the chest or abdomen while coughing. The cough can be so violent as to cause retching, vomiting, difficulty breathing, and even nosebleeds. The main cough modalities include worse immediately upon lying down at night, worse after midnight, worse from eating, worse from drinking, worse from talking, and worse in a warm room. Hepar sulphuris is another croupy barking cough remedy. The Hepar cough is usually less dry and more productive. Think of it as a later stage cough remedy with chest congestion, a loose, rattling, hoarse cough, and production of thick yellow mucus. Hepar often follows aconite and or spongia, and like those two remedies, the cough tends to develop after exposure to cold, dry air or winds. The cough is aggravated by cold air or by becoming cold. Hepar is hypersensitive to pain, very irritable, and generally very chilly. Conversely, Hepar seeks heat and feels better from warmth. The key feature of a Rumex cough is that it is triggered by moving air as it hits the airways. The cough, which is produced by tickling or itching in the throat, larynx, or trachea, is very sensitive to the flow of air, especially cold air. As a result, the person tries to regulate any inhaled airflow by breathing slowly or by taking shallow breaths. Covering the mouth with a hand helps to avoid cold air and to keep the airflow warm. This type of cough can be quite persistent since every breath can potentially trigger a dry, tickling sensation. Anything that buffers the airways from cold air can help ameliorate the cough. Modalities include worse from cold air, dry air, or open air, worse breathing in, worse talking, worse laughing, and worse from touching the external throat or larynx. The cough is better from covering the mouth, better warmth, better drinking, and better by sucking on a candy or lozenge. The Rumex cough can also be accompanied by a raw feeling in the throat or chest and the production of a great deal of thick mucus in the larynx and or throat. Aconite fits the early stages of a violent cough brought on by exposure to cold and or dry winds. The onset of symptoms such as fever and chills is sudden and intense, and the cough is usually dry and barking. It fits the early stages of croup, flu, bronchitis, and even pneumonia, especially left-sided pneumonia. The person who needs aconite is often very anxious and restless and may have a fear of imminent death. The cough is worse at night or lying down at night, worse from cold or dry air, and worse from windy, stormy weather. There's usually a thirst for cold drinks. Aconite is the first remedy given in the early stage of croup, before Spongia and Hepar sulph. Like aconite, phosphorus is similarly anxious, but the symptoms are not as sudden or intense. Phos is the best example of a constitutional type that is prone to respiratory conditions. This is also true of remedies like silica, calcarea, sulfur, barytocarb, and others. So we rely less on the specific symptoms of the cough and more upon the mental and constitutional general clues to choose these remedies. Phosphorus desires company and feels better with company, and has a notoriously strong thirst for large quantities of cold drinks. Every phosphorus cold or flu tends to drop down into the chest, resulting in bronchitis or pneumonia. The phosphorus cough can sometimes produce blood-streaked phlegm. The cough is worse from laughing, better from a cold drink, worse while lying on the left side, and better lying on the right side. Arsenicum, likewise, tends to be identified by its mentals and generals. Arsenicum is very anxious and restless, does not like to be alone, is very chilly, complains of burning sensations, and has a notorious thirst for frequent small sips of liquid. The cough often has its onset or is worse around midnight, or worse between midnight and 2 a.m. It's worse from cold air, better from warmth, and better from warm drinks. Arsenicum fits coughs associated with the flu, asthma, bronchitis, and pneumonia. Antimonium tartaricum is a remedy for notoriously loose, wet, noisy coughs. In fact, it is best suited for situations where the person appears to be drowning in his own mucus. Although the cough is deep and wet, and there is much rattling of mucus, the person is nevertheless unable to expectorate, or to cough much of the mucus up from the chest. As a consequence, there's a great deal of chest congestion and a feeling of suffocation. Although this symptom pattern could fit anyone with bronchitis or pneumonia, for example, such circumstances are more typically seen in either very sick infants or older individuals who are drowsy, weak, and debilitated. Since it is not possible to adequately clear the chest, there can be much difficulty with respiration. The person is forced to sit up in bed in order to breathe. Antimonium tart is very chilly, even freezing cold, and may become cyanotic from lack of oxygen, with blueness of the lips or face. The Ipecac cough is severe and spasmodic and is usually accompanied by nausea. Persistent and oftentimes severe nausea and vomiting are dominant features of many Ipecac complaints. When a person with a respiratory problem complains of nausea, we immediately think of Ipecac. There can be difficulty breathing and suffocative attacks that lead to gagging, retching, vomiting, and cyanosis. It's a remedy for croup, bronchitis, pneumonia, whooping cough, and asthma in both children and adults. There can be hoarseness, a rattling cough, rattling breathing, wheezing, blood-tinged expectoration, and even nosebleeds produced by coughing. Generally speaking, Ipecac tends to be very irritable, is worse from warmth or becoming heated, has a clean tongue in spite of its digestive troubles, and is usually thirstless. The cough is ameliorated by cold drinks. Cuprum metallicum is another remedy for spasmodic coughs. In fact, cuprum is one of the main remedies for violent, convulsive, spasmodic symptoms in general. There can be suffocative attacks, jerking and cramping of muscles, clenching of the jaw, fingers, and thumbs, and cyanosis. The person coughs until he turns blue in the face. One odd clue is that paroxysms of coughing can occur together in groups of 3. The cuprum cough is worse at 3 a.m. and is ameliorated by cold drinks. Coccus cacti is another violent spasmodic cough remedy. But in the case of this remedy, the cough produces a great deal of thick, ropey expectoration. Frequent attacks of violent, tickling coughing can end with vomiting of large amounts of clear or white phlegm. Mucus can hang from the mouth in long, ropey strings. I've seen a good number of Coccus cacti cases where the patient was exhausted from a cough that had lasted for weeks or even months. Important Coccus cacti cough modalities include worse on waking, worse at 6 a.m., worse at night, worse in a warm room, better from cold air, and most importantly, this is another cough remedy that is better from cold drinks. As we would expect, the belladonna cough is sudden and intense and may be accompanied by a high fever, redness of the face, throat inflammation, and a throbbing headache. The cough can be dry, tickling, or spasmodic, and may be worse at night and worse from a warm room. The causticum cough has been described as a hard, hoarse, hollow cough that racks the body. The cough can be wet or dry, and there is constant throat clearing and coughing in an attempt to bring mucus up from the airways. Unable to clear the mucus, he swallows it instead. Causticum is a remedy for asthma, bronchitis, laryngitis, croup, whooping cough, and pneumonia. Generally speaking, causticum is chilly and is prone to sad, weepy moods when sick. The cough is aggravated by cold air and ameliorated by cold drinks. So like I said earlier, I won't be able to cover all possible cough remedies here, so I'll list some additional remedies that are worth studying. They include bromium, corallium rubrum, dulcamara, calibachromicum, calicarbonicum, hyoscyamus, lachesis, nux vomica, rustox, sambucus, sanguinaria, silica, sticta pulmonaria, sulfur, and squilla. Okay, so I thought I would finish up with a mini repertory of cough remedies, beginning with coughs that are better from cold drinks, which include causticum, Coccus cacti, Cuprum, Ipecac, and Phosphorus. Coughs better from warm drinks are Arsenicum, Bryonia, and Spongia. Coughs triggered by cold, dry wind include Aconite, Causticum, Cuprum, Hepar, and Spongia. Dry cough remedies include Aconite, Arsenicum, Belladonna, Bryonia, Causticum, Coccus cacti, Cuprum, Drosera, Hepar, Ipecac, Phosphorus, Pulsatilla, Rumex, and Spongia. Remedies for expectoration from coughing include Aconite, Coccus cacti, Phosphorus, and Rumex. Spasmodic cough remedies are Antimonium tart, Belladonna, Bryonia, Causticum, Coccus cacti, Cuprum, Drosera, Hepar, Ipecac, Phosphorus, Pulsatilla, Rumex, and Spongia. Suffocative cough remedies include Antimonium tart, Arsenicum, Coccus cacti, Cuprum, Drosera, Hepar, Ipecac, Phosphorus, and Pulsatilla. Tickling cough remedies are Aconite, Belladonna, Bryonia, Causticum, Coccus cacti, Drosera, Hepar, Ipecac, Pulsatilla, Phosphorus, Rumex, and Spongia. And lastly, wet, loose, rattling cough remedies include Antimonium tart, Arsenicum, Belladonna, Bryonia, Causticum, Hepar, Phosphorus, Pulsatilla, and Spongia. Okay, that's it for cough remedies. It's probably worth watching this episode a few times over so that all the information has a chance to sink in. Thanks for watching. Be sure to subscribe, and I hope you'll tune in again to the next All Things Homeopathy episode. May the vital force be with you.